Hello and welcome to our COVID-19 special program. I am Ladi Akiridoluale. Here are the highlights at this hour. National Center for Disease Control, NCDC, plans 2 million COVID-19 tests in the next 3 months. Federal government says lockdown in Lagos, Abuja and Ogun will remain until relaxation measures take effect. And confirmed COVID-19 cases in the United States passed the 1 million mark. The Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu, has re-emphasized that the goal of the federal government is to fight to reduce the number of transmissions of COVID-19 in persons. Dr. Ihekwazu explains that the present goal is to have 2 million Nigerians tested in the next 3 months. He was speaking at the briefing today on COVID-19 by the Presidential Task Force in Abuja.
One of the key things that will enable us to do this efficiently for Nigerians is to avoid non-essential travel. So really, that is a very difficult thing to do, but I'd like to remind everyone that this virus doesn't fly on its own from state to state. It is carried by us. So our goal really is to avoid transmission, to avoid infection, and to keep the state with no case or few cases exactly that way. In order to test 2 million people in 3 months across the country, we need to test about 50,000 per state, plus minus depending on your population size. There's no other way we can do this. We need the cooperation and collaboration of every state government in Nigeria, every department of public health, and we need the collaboration of the people living in these states. The only entry point into control of this outbreak is through testing. Because of the number of asymptomatic infections and mildly symptomatic people, we really can't understand the size of the problem if we do not test.
The Secretary to the Government of the Federation, Boss Mustafa, in the meantime, has asked Nigerians to begin to learn how to adjust to the new reality which the global COVID-19 pandemic has brought up. He firmly reiterates government's resolve aimed at protecting its citizens, particularly at this period. Mr. Mustafa said this at the daily briefing of the Presidential Task Force on COVID-19 in Abuja.
The broadcast was an expression of President's determination to provide leadership while at the same time ensuring that the rights of Nigerians are respected, security provided for all citizens, the poor and the vulnerable are protected, and the minimal discomfort experienced even in the face of a global pandemic that is ravaging the wealth and the health of the world. He also reiterated the resolve of government to continue to protect the lives and the livelihoods of the citizens. Let me at this point inform you that the lockdown for FCT, Lagos and Ogun states shall remain in force till Monday, the midnight of Sunday, 3rd May 2020, after which the new regime of measures shall take effect. Law enforcement agencies shall therefore continue to enforce the restriction of movement. The PTF also implore Nigerians to please continue to adhere to the restriction orders.
Now we are going to take a look at the new measures nationwide to be introduced as announced by President Muhammadu Buhari. First, there will be an overnight curfew from 8 p.m. to 6 a.m. This means all movements will be prohibited during this period except for essential services. There will be a ban on non-essential interstate passenger travel until further notice. Partial and controlled interstate movement of goods and services will be allowed for those movements from producers to consumers, and strict enforcement of the mandatory use of face masks or coverings in public, in addition to maintaining physical distancing and personal hygiene. Furthermore, the restrictions on social and religious gatherings remain in place. State governments, corporate organizations, and philanthropists are encouraged to support the production of cloth masks for their citizens. Now, all these measures are expected to come into effect on Monday, the 4th of May. Now, joining me via Skype to take a look at these measures and indeed some of the other things that have happened is Dr. Bolanle Balogun, who is a public health physician. Good evening, Dr. Balogun, and thank you for your time.
Good evening. Thank you for having me.
Now, quite a lot has happened in the last couple of hours. First of all, of course, we had the measures as unveiled by the president yesterday. And then today, quite a number of other developments have come up. The U.S. President Donald Trump promising to send ventilators to Nigeria. Then just a couple of minutes ago, the IMF approving Nigeria's $3.4 billion loan request. The National Assembly also approving 500 billion naira in COVID-19 support funds as well. Do you think all this are moves in the right direction, especially if they come through?
Thank you for your question. I would say yes. It's all going to work together for our good in the long run. You know, our president had to make a difficult decision to ease the lockdown. You know, he had to weigh the health of the populace vis-a-vis, you know, the strain on the economy as a result of the lockdown. And then with the ongoing measures that are going to be in place, we're going to need the resources. We're going to need, you know, more money to purchase more test kits. We're going to need more resources, even for active case search, which must go on. You know, testing must go on, contact tracing must go on. In fact, they must be intensified, you know, as we go forward with easing the lockdown. So as many of these resources as we can get, as much collaboration as we can get at this time is something that is very welcome, I must say.
The presidential broadcast was carefully worded, well worded. In effect, what had happened was that the lockdown was extended by a week until Monday the 4th. During this period, what should we be doing? What should the authorities be using this time to do, this final 1 week before the gradual relaxation starts?
Yes, so I mean, the president has given us a guideline, and it's not left for every state government, you know, to adapt it, you know, to what would be meaningful and useful for their population, you know, given the difference in sociocultural backgrounds that we have in the different zones in the country. But we need to address, you know, certain things. You know, like the president rightly said, it should be gradual and should be phased out. So I think before this 1 week that we have, I'm sure state governments are looking very closely, sort of like a micro planning, you know, to look at things, to address even things before we ease the lockdown. So a lot of people are anxious about, you know, going back, even though they were the ones clamoring for an end of the lockdown. So the guidelines that the state governments will put in place will help to ease, you know, the anxiety of people, knowing that our government has, you know, a plan for us. We also need to look at things about, you know, transportation. Now we're saying people can, some essential, you know, services can return back to work. We're going to allow some businesses to start. We have to ensure that people are safe when they, you know, have to transport themselves, you know, to and back from work. So there has to be a lot of engagement with the National Union of Road Transport Workers, Ministry of Transportation, to ensure that all the right public health measures are put in place. And then even when people start work, every organization, no matter how small, has to have a guideline as to the minimum amount of public health measures that they need to put in place. You know, such things like no handshaking policy, ensuring that they have access to running water and soap, use of hand sanitizers. Some people can work from home or having, staggered, time at work. Okay, no, it doesn't mean we now start having our large meetings again. We can use technology that we have been using in the course of the lockdown. And the most important is even engagement with management, people, in charge of offices, association bodies, to ensure that we have their buy-in. Now is not the time to be stingy, with resources. We need to ensure that, the health of the workforce, the health of the communities are, protected and preserved.
Going ahead of what is that is currently happening, in many places, people are moving around, which is why I guess the issue of interstate travel comes in, because a lot of those who are infecting or who are passing around this infection, especially in the states that are getting new infections every day, are people moving from various states. You have persons from Lagos going to Ondo State, you have those from Kano going to Jigawa, and a number of others. But this is happening in spite of the fact that in some of those areas, they are under lockdown. So even if this is extended or there's a ban now placed on interstate travel, it will be an enforcement issue, wouldn't it?
Yes, it would. It would. In fact, Nasarawa has reported his index case was someone who traveled from Kano, despite, an interstate travel ban. So enforcement is critical. Okay, who is manning, the borders? Who is ensuring, that people don't cross these borders? It's important that we look into this so that the gains that we have, so far from each state's lockdown, we will not now start to see, a reversal of our gains. So enforcement, I agree with you, is very critical.
Finally, before I let you go, Dr. Balogo, you mentioned earlier in the conversation, you talked about active case search. The lockdown in Lagos, Abuja, and Ogun State was supposed to be, facilitating this active case search, especially as we have now moved from the phase of imported cases to those being spread within the communities. Do you see that continuing within this period, and especially after the gradual relaxation of these measures is implemented?
Oh, yes, it is extremely vital, and it's even something that we need to ramp up, because as we all know, most of the cases are, either mild or asymptomatic. There are people walking around with the virus, spreading it, and they don't know. So we need to, and some are hiding, the symptoms that they have in their communities, in their homes. So we need to go closer to the communities to ensure that at least we have, and Lagos State has set a good example. We have, sample collections in 20 local governments, so that means that people can easily get their samples taken, and more people, can be tested. And with the drive, by NCDC to increase testing to 2 million, we need that now more than ever. Otherwise, we will not be able to test close to 2 million people within 3 months. So we must ramp up on active case searching all over the nation.
Dr. Balogo, thank you so much for your time on our program this evening. From Lekki in Lagos, Dr. Balogo joins us via Skype.
Thank you.
The Senate has given accelerated approval to President Muhammadu Buhari's request for a loan of 850 billion naira from the domestic capital market to finance projects in the 2020 budget. The approval comes as the Senate reconvenes after a 5-week break over the ravaging coronavirus pandemic. The upper chamber is asking the executive to fast-track the submission of the revised medium-term expenditure framework, the fiscal strategy paper, and 2020 budget to the National Assembly for passage. Our correspondent, Linda Akibe, joins us from our studios in Abuja now. Good evening, Linda. Trust that you're keeping safe. What more can you tell us about the goings-on at the resumption of the National Assembly today?
Hello, Ladi. Good evening. Now, the National Assembly resumed today after going on break for nearly 5 weeks over the coronavirus pandemic. Attendance was more than average in the Senate and House of Representatives, and it appeared that federal lawmakers are taking personal safety seriously in the chambers as they were wearing face masks and maintaining physical distancing inside the chamber. However, there were no thermometers at the entrances of a National Assembly, which is what the leadership of the House of Representatives had said would be provided to check the temperatures of people coming into the Assembly complex. It was also difficult for National Assembly staff and journalists to gain access to the Assembly, and some journalists were turned back even with valid identity cards. Perhaps this was done intentionally by the National Assembly management to reduce the number of people inside the Assembly today, as a preventive measure against the spread of the virus.
Welcome back. Thanks for staying tuned to our COVID-19 update program. Let's find out what's happening in some of the states, shall we? Starting with Niger State, where our correspondent, Emperor Simon, says the state government has relaxed the lockdown situation in the state to allow for movement within the locality while enforcing the law on compulsory wearing of face masks. Emperor will provide details in just a moment.
For the first time in 3 weeks, we've seen roads in Mina, the Niger State capital, without security presence. For instance, this used to be a checkpoint. As a matter of fact, you can still see tires lying on the road, but no security agent to man the checkpoint. Now, it's not because they do not want to, but because the state government says even though it has extended the lockdown by 2 weeks, today being Tuesday is one of the windows it has provided for people to go about their normal businesses. Other days that the state government says people can also go out are Fridays and Sundays. Friday between the hours of 11 a.m. to 3 p.m. while on Sunday between the hours of 7 a.m. to 12 noon. Now, another good news we've received is the fact that the first index case that was recorded in the state is beginning to show signs of recovery. The test, which is of course the first test to be carried out, came out negative. However, a second test will still be conducted. And if that test comes out negative, it means that only one case of COVID-19 may still be in Niger State. The citizens here are happy that the curve of COVID-19 in the state is gradually flattening. However, perhaps it's not yet time for the state government to go to sleep. From Mina, Emperor Simon.
Thank you, Emperor, reporting from Mina in Niger State. The number of COVID-19 cases in Nigeria with no epidemiological link is now over 40%. That's talking about unknown sources of infection. This is a strong indication of the growing community spread of the virus. With 64 new confirmed cases recorded yesterday, the total number of confirmed cases in the country stands at 1,337. 255 cases have been discharged and 40 deaths recorded in 32 states and the Federal Capital Territory. And there you have the state-by-state breakdown of the cases. Of course, you have that on the NCDC website as well at www.covid19.ncdc.gov.ng, where you can also go for more information, including the advisory for the Ramadan period, as well as self-isolation and the quarantine guide. Joining me in the studio is a consultant public health physician, Dr. Alera Roberts. Thank you so much for being with us. Welcome once again.
Thank you very much for having me, Ladi.
So much has happened in such a short period of time. President Trump says he will send us some ventilators. I expect that quite a number of people will ask the same question. But the IMF has also approved this $3.4 billion loan request for us to be able to cover this COVID COVID-19. And the National Assembly has approved that we also borrow money from the domestic market for the same purposes. And there are a number of measures that President Buhari announced yesterday that will be part of the gradual reversal of the lockdown. Do you think all these are adequate? Are they steps, in your view, in the right direction?
There are certainly steps in the right direction, Ladi. The question is, will they be properly applied? Because it's one thing to have the remedies that are required, and a lot of it is going to cost a lot of money. It's another thing for the remedy to be properly applied. So we all hear about the joke about the woman whose son was coughing and her friend says, "I'll give him sanitizer to drink." Sanitizer is useful in corona COVID, but certainly not to be ingested or injected, or any other cleaning agent to be ingested or injected. They're merely to be used to wipe down the surfaces and frequently touched areas. So coming back to the issue of remuneration, we've heard it said that this last week, people should spend that time micro-planning and decide how you intend to go forward, whether you are a Yabasira selling rice by the roadside, or you are KFC, or you're a school or a university, or you're an organization with many people coming into the office to work. So this is the time we need to put those plans in place. And I know a lot of us in the Association of Public Health Physicians have been consulted to come in and help put in place public health measures that are tailored to each circumstance. So for instance, the issue about schools going back. Now, we know the government is going to say a date when schools can return. And we know there are some schools that have been able to do online learning and some schools have not. So the issue is, when do you bring the children back to school? And when you do bring them back to school, what needs to happen? Because whether we like it or not, Ladi, this virus is with us until a vaccine is found. And by the best projections, we're talking about summer 2021 at the earliest. So whatever we're doing, we need to accept that there is a very new normal. COVID is not going to go away May 3rd. No matter what President Buhari announces, it is not. So the issue is, what are we doing post-COVID? How do we address the new normal? And this is not just from the government down to the people. This is also from the people between themselves, within their families, within their communities, within the society. Everybody needs to plan for a post-COVID Nigeria. So
let me put you on pause. I'm being told that it looks like we can speak to our correspondent, Olu Phillips, who is somewhere in the heartland of Lagos. Is Olu still there? Well, I understand that we seem not to have been able to make the connection. Olu, if you can hear me, what is the situation? How are people reacting to the issue of the lockdown being extended and then gradual relief happening, and then the whole issue of the gradual unlocking of things, curfew and all that? And are they still talking about the vexed issue of palliatives?
Ladi, let me start from the last to the first. Lagos has the unfortunate status of being the epicenter, so that everybody who came into this country and everybody who got infected came in through the Lagos airport, most of them, I should say. And so it meant that everything that concerns Lagos is something that was always going to be on top of the front burner, in front of the front burner, and will continue to be a conversation. When it comes to palliative, and what is regarded as Lagos's biggest local government area, Limosho local government, and some even dare say it's the biggest in Africa. Now, I've been speaking to a lot of people since about 1 hour plus when we arrived here to ask them specifically as regards palliative. And they tell me that this is all about Photoshop. It's about photo business. That these palliatives get to a particular place, they take pictures, and that's it. And a lot of them that I've spoken to randomly say they have not seen anything in terms of what has come to Lagos State. And so the federal government, for instance, says it has given Lagos State over 6,000 6,000 bags of 50 kg rice and some groundnut oil. And Lagos State on its own has also said they have been distributing food items as it were. But I don't know what it is. I don't know where it's gone to. But all of the people we've spoken to are not happy, and they can't wait for this extra 1 week to be up. They just want to go face their life. They don't want to be seen as beggars. They want to get back to the street, get back to their workplaces, and begin to just get their lives moving, Laddie.
Ladi, let me start from the last to the first. Lagos has the unfortunate status of being the epicenter, so that everybody who came into this country and everybody who got infected came in through the Lagos airport, most of them, I should say. And so it meant that everything that concerns Lagos is something that was always going to be on top of the front burner, in front of the front burner, and will continue to be a conversation. When it comes to palliative, and what is regarded as Lagos's
Finally, Olu, before I let you go, because I see that there's a crowd gathering right behind you there, and one would have expected that, given the social distancing rule, there'd be some a gap between them and yourself. The other point that needed to be raised is that with the relaxation measures that have been introduced, are people prepared to comply, in your view, with those gradual relaxation measures? Because it would appear as if some people think that come next week, Monday, the 4th, is back to business as usual.
Larry, if I could hear you very clearly, I hear you ask how people are going to transit from 4 weeks of not inactivity into Monday, 4th of May, into a life of activity. I think there's a disconnect between what the president tried to say as regards Monday and days after Monday. So there's a disconnect, because people think come Monday they will just go to their shops and open. So they're not very sure. They don't know if it's about the SMEs, if it's about industrialists, if it's about the manufacturers, if it's about the office persons. Because if the curfew is going to start by 8 p.m. every day nationwide from Monday, it means, for instance, if you're on the island and you live on the mainland, once it is 4 o'clock, you have to be back home before 8 p.m. Otherwise, you'll be caught in the web. And this transition isn't going to be smooth. People think when come Monday, 4.5 weeks of their life being caged in by way of lockdown will be over. But I'm afraid this is not the situation, and this is where the campaign has to be stepped up and a proper explanation done to people as regards how they are going to transit smoothly into easing out from the lockdown, laddie.
Olu, there are people behind you. I noted that when I was about to ask the second question, I noticed that there are quite a lot of people hanging behind you. I wonder if they are aware of the social distancing rule and that you have repeatedly tried to get them to observe that rule as you are conducting this interview. Have you been able to succeed? Because it doesn't look like so from the picture that we have.
Yes, it's crazy, laddie. I came here with almost a liter of hand sanitizers. I've been trying to get these people to understand what it means to be physically distant from the next person. But they're not going to listen to any of that, because as far as they're concerned, there's a disconnect. I mean, they need to, they don't understand what it is as far as all of this is concerned. They just want to hear, you know what, get back to your business, get back to your life. And they don't even believe that corona is real. And no, hold on, guys. Whether you believe it or not, corona is real, and you got to keep safe distance, guys. Yeah, this is how terrible it's been all day. You can see, laddie, oh my goodness, laddie, I don't know what to say, but I'll be safe.
All right, I take your comment about you being safe, and of course, keep passing on the message and keep keeping safe. Correspondent Olu Phillips there reporting, of course, from the biggest local government in Lagos, Alimosho. Back to the studio where Dr. Roberts is still with us. Dr. Roberts, a typical example of some of the difficulty that this is going to face. And that brings the next question that I was going to ask, which is the issue of the transition. You already touched on it, where you know, when we're talking about going from 0 to 100, it does seem as if there's some disconnect, isn't it?
Some disconnect, laddie. This is the reality. This is what we've been trying to say for the past 4 weeks. This was why the frontliners really wanted the lockdown, because it at least kept them safe. Now look at the problem that Olu is you could see the palpable fear in his face, because he was now being crowded in by people breathing all these viruses onto him. This is the huge chasm of disconnect that we're going to have going forward. And how do you now tell the majority of the Lagos population this is not back to business as usual? The fact of the matter is that, to be very, very honest with you, a lot of people are going to be affected badly by getting the virus and become very, very ill. You know, because these are people whose immune systems probably can't withstand it, who have comorbidities, and these are an issue, and they haven't even understood. I mean, we've been trying to get this message across of comorbidities for years, even decades, and people just don't take it seriously. Is this what they're going to take seriously? Until the reality begins to happen. And this is not doomsday prediction, but there is going to be a second wave. There are going to be more and more positive cases, and there are not going to be enough health service delivery points to deliver service, because as fast as the cases are coming forward, frontliners are withdrawing from the front line because they've got to look after themselves. It is clearly obvious that government can't cover everybody. I mean, what did he say? I did a quick calculation. 6,000 bags of 50 kg rice. Do you know how many kgs that is? 300,000. In a state of more than 20 million? I mean, really, laddie.
Before we go on, I must ask, the situation in Kano, is that another example of what could possibly happen in more places if this containment and gradual relaxation strategy doesn't work?
I'm not too sure, because to be honest with you, we don't really have any indication that what is happening in Kano is strictly and completely COVID-19 related. A lot of us have speculated, could there have been organophosphate poisoning? It's happened before in Jos, where there was a huge outbreak of mercury poisoning. So to speculate about the Kano situation and use it to extrapolate what might happen around the country, I wouldn't be so bold, no. But that we would see service failure in service delivery, oh, definitely we will see failure in service.
Coordination also seems to be another problem that has not been addressed by the president's broadcast, or indeed by the authorities. All along, you've had a situation where the federal government locked down Lagos, Ogun, and the FCT. But then you had about 33, 34 other states unlocking and locking and unlocking and locking up from time to time.
Absolutely.
And even these gradual relaxation measures that are to be introduced from Monday, the president says the state governors, each state, is at liberty to decide how to go about it and so on, which means that a state can go very fast while others take it slower. But then because they've gone very fast, possibly what's happening there could affect those who are still taking it slowly.
That's true, but that is the beauty, the disadvantage and advantage of being a federation. The state, I think it was very wise of the president to give the state governors that leeway to say, listen, you all have to, because at the end of the day, the state governors are still closer to the people than the president is. And if a state governor is smart and like Lagos, he will listen to his local government chairman. So what is going on in Alimosho is not going on in Etiosa. Therefore, you need to be able to then take in the peculiar context of the area, the community in which you are, what will work and what will not work. So yes, some states will move very fast. Cross River is a perfect example. And some states will be a little bit slower. And some states will be harder hit, Lagos, Ogun, FCT. And some states may not. Taraba, Yobe, Gombe will not face the same challenges that we are seeing in the Southwest. So giving the state governments liberty to read the situation in their states and react accordingly is actually a very smart move.
Finally, and I want to use this, I don't know if it's some form of extrapolation, if you like. One of the few countries, I'm told, that has no case of COVID-19 is Lesotho. And that's because, going by the arrangement, as soon as the first case arrived South Africa, Lesotho sent the army to its border and sealed it up. So even those who are citizens of the country who were outside were not let back in. With benefit of hindsight, could we be much bigger, be much more complicated, have considered such an option?
Not have. We certainly could not have. There was no way we could have. I mean, Lesotho, population-wise, they're so small. They are a landlocked country. And this is what we are saying. One size cannot fit all. This is what we are saying, because even when we came to the issue of the closing of our airports, for example, we all subliminally knew that until certain big boys had their children safely back in country, no airport was going to close. Because, by comparison, a lot more of our children here are at school outside than Lesotho can boast of. So these are the peculiarities that we say you've got to read the context of what's going on in your country and what can help you and what can work for you. So no, we couldn't have done. Even China, who could do the autocratic lockdown Wuhan, lockdown Hubei, didn't lock down the whole of China. And even now we've got a situation in one of the towns that are on the borders with Russia, and there's nothing they can do about it, or they're trying to contain it as best they can. So one size does not fit all, not within a country, not even between countries. So everybody has to take the broad principles and the broad guidelines and then domesticate it to their local context.
Dr. Roberts, it's always a pleasure to speak with you. You give a lot of food for thought to those who are listening and those who possibly can think. Thank you so much for being our guest on the program today.
Thank you very much for having me.
We'll take a break, and when we come back, we'll go outside our shores indeed to find out what the update is on both counts. Do stay on with us.
Glow Unlimited.
Thanks for staying tuned. Welcome back to our COVID-19 update. Beyond our shores, another 586 people have died in UK hospitals after contracting COVID-19, bringing the total to 21,678. Health Secretary Matt Hancock announced the new figures at the government's daily briefing on the pandemic. Mr. Hancock also announced that from Wednesday, the government's daily figures on the coronavirus deaths would include those in care homes and in the communities. We're now being joined by our correspondent in London, Juliana Olainka. Juliana, good evening. Trust you're keeping safe in the midst of all of this, but it's good to see you.
Good evening. It's lovely to see you too. Yes, keeping safe amidst all the grim and darkness in Britain at this time.
Indeed. Now, the figures are, even though lower, still astounding. What more can you tell us about Matt Hancock's briefing today about what Britain is doing and intends to do?
Well, Matt Hancock, the Health Secretary, he gave the daily coronavirus briefing today. Parliament has now reconvened, and tomorrow there'll be Prime Minister's questions, where Prime Minister Boris Johnson will finally be back in the chambers and will have to face the new Labour leader, Sir Keir Starmer. And it's been a pretty dreadful couple of weeks for the British government. We've now joined the big 6 COVID-19 countries, which include America, Belgium, France, Italy. And there are so many questions as to why, considering Britain's vast expenditure in healthcare, that we've found ourselves in this situation. Matt Hancock did say today that he would, from tomorrow, be adding the deaths from care homes and within the community into that daily death toll, because we haven't been having those figures previously. And we've been getting some rather dark statistics from the Office for National Statistics about just how many people are dying from COVID-19 mishaps within these residential homes. Now, at the moment, the figure just stands under 22,000, but figures released from the ONS today show that in 1 week, over 6,000 individuals died, just over 1 week, inside these residential homes. Of course, there have been so many cries for these figures to be added, and I think the government may just have been slow to do this because they know that, again, that will increase the death rate here in the UK by so much higher. But they said they will be doing that tomorrow because they have the capacity to do that so far. So now there are questions as to why there isn't enough PPE in these residential care homes. We know that in the UK over 500,000 vulnerable adults do live in these homes, and several of them are suffering from disabilities, which means it is difficult to keep up to those social distancing measures that the government do advise, and it has unfortunately spread like wildfire. I believe I was listening to one care worker working in a home who said that some of these places are like morgues at the moment.
All right, Juliana, thank you for that update. Correspondent Juliana Olaika. Please continue to stay safe. Look forward to talking to you again very soon.
Thank you.
More than 1 million people across the United States have contracted COVID-19, surpassing China in March for the most confirmed cases of infection than any other country. The death toll, according to a tally by the Johns Hopkins University, has passed 56,000 and is getting closer to the 60,000 mark.
International Rescue Committee bases its concerns about rising cases of coronavirus on fragile countries such as Afghanistan and Syria, where there has been conflict. They say the countries need urgent funding to avoid a major outbreak of the pandemic. So far, more than 3 million people globally have contracted the coronavirus, with more than 200,000 dead. In Europe, where nearly half of the deaths are accounted for, some countries have been seeing a drop in the number of deaths. For example, Spain. The daily death toll fell today to 301 as of this afternoon, far below record highs of 3 times as much in early April, which should allow the government to set a framework for regions to start phasing out one of Europe's toughest lockdowns. France is also looking to unwind its 6-week lockdown. Prime Minister Edouard Philippe faces a delicate balancing act, keen to relieve the mounting frustration of people holed up in their homes since mid-March without heightening the risk of a second wave of infections if the country moves too swiftly.
Our correspondent in Washington, D.C. in the United States, Maria Bird, joins me. Good evening, Maria. Grim figures, more than 1 million people in the U.S. now infected. Quite quickly, what more can you tell us about that?
As testing has increased and the availability for testing has increased, that obviously gives more people an opportunity to see if they are actually infected with the coronavirus. And so that is one piece to it. But obviously the spread is still happening. I mean, you've had essential employees still going out to work each and every day. And now with the reopening of the country in many states, that is a potential risk for even a larger spread throughout the U.S.
In 20 seconds, Maria, what else came out of these figures in terms of the death figures now approaching 60,000? How are people reacting to that?
Yes, the death tolls are reaching close to 60,000, and at this time, they're really trying to figure out what are some of the reasons for the death tolls continuing to increase. Why are there not treatments available to be able to address the issue, especially for those individuals that are most vulnerable with underlying conditions, and actually the young are now becoming more impacted than they thought they would be. So there's still a lot to be asked about. There's still a lot to be looked into. But again, the economy has become a real issue for the U.S., and so the reopening is seeming as if it's not going to start regardless of the health implications.
All right, then, Maria Bird, our correspondent in Washington, D.C. in the United States, thank you for your time, and do stay safe out there.
Thank you.
And that's where we wrap it up, our COVID-19 update for tonight. My name is Ladi Akeredoluale. Good night.